Hello guys and welcome to my YouTube channel. My name is Mario and in this channel we'll be talking about mostly makeup. Thank you very much for your likes and subscribes. I always see that. I know that we are growing little by little, but we are there. I know that I haven't been here for a while, but because of the pandemic situation that finally is coming to its end, I have been looking for a job and taking courses and stuff. So I have seen some pictures on Instagram about, how can I describe that? This picture of this guy that he has in one side of the face a lot of colors and in the other side of the face like a natural look kind of thing. I found it really interesting and really fun, so I thought to recreate that look. I'm going to try to do something different this time. Usually what I do is I tell you exactly what I do when I'm doing it, but I think that this time I would like to be a little bit chatty with you. So let's get started. You know guys, as usual, I already washed my face, put toner, moisturizer, serum, and sun protector. Well, not in that order. Serum and then moisturizer and then sun protector. So that is already there. What I'm going to do now is apply primer, and I'm going to use this primer by The Ordinary. Guys, do you know anything about PrEP? I have talked with some people and I realized that many people don't know what PrEP is. And I think that is really important for everyone to know what PrEP is. Let's start with HIV. HIV is a virus that attacks the human immune system, and this is affecting in a way that weakens the ability to fight an infection and disease. This virus can be transmitted by blood and by fluids, semen, blood transfusions, really rare over oral sex, during pregnancy, breastfeeding, sharing needles, unprotected sex. Now for foundation, I'm using the Urban Decay foundation in the shade 30CP. I'm going to leave a link in the description below so you can see the full information about PrEP, PEP, HIV, etc. Because I'm not a doctor, but I'm sharing with you my experience. I think that the more information is out there is better for everyone. Okay, we are going to talk about PrEP, but before that I'm going to set my face with this Kimchi Chic translucent powder, and the shade is PPP Extra 01 No Color. So PrEP stands for pre-exposure prophylaxis. And what it is a pill that you take every day, and it helps to prevent getting HIV. So PrEP only protects you against HIV. You have to be aware of that because there are another STDs, hepatitis, gonorrhea, syphilis, etc. And this medication doesn't protect you against that. When I started to take PrEP, the doctor told me that for men, take this pill every day for 7 days, and then on day 8 you are protected. For women is 28 days, and then the day 29 you are protected. There's another way to take PrEP in case that you don't want to take it every day, and I'm going to tell you about it while I do my contour with this Anastasia Beverly Hills bronzer in the shade Saddle. If you don't want to take PrEP every day, you have to consider when do you think that you are going to be exposed. And by that I mean, let's say, for example, you're going to have sex tomorrow at 5 p.m., right? So you have a margin up to 2 hours before, which is 3, and 24 hours before, which is 5 today. So if you are having sex at 5 p.m. tomorrow, you can take from today at 5 p.m. double dose and up to 3 p.m. tomorrow, so you are protected for your 5 tomorrow. The process doesn't finish there. So what you're going to do is you are going to take this double dose in the margin between 2 and 24 hours, and then you have to take one pill the day after and another pill the day after, and you are done with the cycle. It's really important that you follow that procedure because you are exposed. But that doesn't mean that you can't wear condom, because remember, it's just protecting you against HIV and not any other STD. Now I'm going to put some blush with the same brush, and the blush is Burnt Pepper by MAC Cosmetics. Now let's talk about PEP. PEP is an emergency treatment that you are going to have in case that you were exposed without protection, neither by condom or PrEP, to make sure that you don't get HIV. In Ireland, when you go to the PrEP clinic, they give you this card. They have phone numbers where you have to go and instructions of what is going to happen if you were exposed to HIV and you were unprotected. Now I am going to draw in this part of my face with this concealer pencil, just to keep going with the fantasy of the look. So okay, so PrEP, right? So let's say that you had sex with someone without condom and without PrEP. What you have to do is to run to the emergency hospital and ask for PrEP. But you have to be really quick because you have up to 72 hours from the exposure of HIV to get this treatment. PrEP is a free treatment that you get, and you're going to take that for 28 days just to make sure that you are no more under risk. Now from the Sample Beauty palette, I'm going to use the shade Smoky to contour this part of the face. PrEP must be taken within the 72 hours of exposure, and the sooner the better. The sooner the more effective it is, right? And you are not allowed to have sex within the 28 days that the treatment lasts, because you are at risk and you don't want to put in risk anybody else. Naturally, if you have safe sex, it's okay, but you know, like condoms can be broke and you don't want to expose anybody else's life. So because of that, you have to be really careful of what you do. It's highly important to know that PrEP is not a cure of HIV, and it's not a vaccine, okay? Naturally, after getting PrEP, you are going to be tested 6 weeks after and 12 weeks after, just to make sure that you are 100% fine after your exposure. By exposure, I mean any circumstances in which you think that you had the chance to get HIV in your bloodstream. Now I'm going to use this body face paint to do some details, and I'm going to start using this angular brush to start with the black area. PrEP is not for everyone. You have to go to the doctor, and the doctor will assess if you are candidate to have PrEP or not, because we are not doctors. They are going to make that decision. Now let's go back a little bit and talk about PrEP again. It's free now here in Ireland. I know that in some countries it's not free. Here in Ireland wasn't free at the beginning. What it was is that you used to get your prescription for 3 months, and you used to pay around 60 euros per month. That's what it was. Now it's free. What you have to do is to go to the PrEP clinic, and they are going to make a series of tests to make sure that you are able to take PrEP. From the same palette, I'm going to use the white. What about the tests that they run in the PrEP clinic? Blood tests, swab tests, and urine tests have to be done every 3 months. With the blood test, what they do is they make sure that you don't have HIV, which is the very first step. You cannot have PrEP if you have HIV already. With the urine, they make sure that your kidneys are working properly, because you must know that medicines, they are metabolized by the kidneys and the liver. What does that mean? That when you take any medication, your body is going to process that through your kidneys and liver, They process what you have and take just the good parts and throw away the bad parts. The first blood test that they run, they check your liver and if you have HIV or not. After that, they don't check your liver anymore unless you ask for that. The swabs, that test is like a cotton bud that is quite long, and what they do is with one of the extremes, they put it all the way inside of your throat and the other one inside of your bum. And the reason why is because they want to find out if you have any other STDs. The PrEP clinic, it doesn't only run tests for HIV, they take care of all of the STDs. If you have any other STD, in that clinic they give you treatment for any of them, which is great. Now, as I mentioned before, this is free. Everything, the tests, the prescription, medication, everything. The only thing that you have to do is, when you are in the PrEP clinic, ask information about one card that is the medical card. When you go to the pharmacy, you can ask for the treatment and with that card you're going to have it for free. How can you get all of this? It's really easy. You just have to book an appointment with a PrEP clinic and they're going to give you a date. In this pandemic situation, you have to make sure that you are wearing a mask and you get in there on time. There are no queues anymore, so you get there instantly in the moment that your appointment was made. Because of the COVID situation, it could be a little bit difficult to find an appointment or to book an appointment, but it's not impossible, of course. You have just to be patient and to be there. Another topic that I would like to talk about is about the people who already have HIV. These people can have a retroviral that helps them to reduce the virus until 0, which means that is undetectable. Once that is undetectable, cannot be transmitted anymore. I'm going to use the shade Fuge for my eyebrow to give it a little bit more of texture. Just to this one. We know that HIV doesn't respect any gender, any age, neither any sexual orientation, right? So because of that, it's important that you keep in mind that it doesn't matter if you are gay, straight, pansexual, bisexual, etc. So it's important that if you are going to have unprotected sex, at least have PrEP. Another common comment that I have seen is that people think that HIV and AIDS is the same thing, and it's not. The difference is that AIDS is a late stage of HIV in which your system is already damaged, like badly damaged. However, nowadays it's less common, thank God, because there are many treatments against HIV. You know, like you can have a treatment of a pill that you take every day, like PrEP as well, and you reduce the virus in your system. So you are making sure that you are keeping your levels low and you can live a regular life. Now with the same shade, the Fudge shade, and with a fluffy brush, I'm going to do a little bit of shadow over here to give this 3D effect. I think that's really important that we take care about our sexual health. Sometimes because people have shame or they don't feel like going to the doctor and talk about it, they just leave the time pass by, and then this can create something bigger and worse. So I highly encourage you to go to the doctor and make sure that everything's fine. Don't be scared for anything. It doesn't matter if you have an infection of anything. At the end of the day, if you go to the doctor, the only thing that can happen is to get better. You can get better. Get the information and get better. Now with the shade Leo, that is this red over here, I'm going to put a little bit more blush in this part so I can accentuate this in the fantasy that I'm trying to create. Now I'm going to use the Suva palette, and to activate this palette, what we have to do is to apply a little bit of water in the shadows, and then with a little brush that we have over here, then we can apply it in the eyes. What I'm going to do is I'm going to apply eyeliner in this part over here, and I'm going to create some details with the white as well. Now with the shade Fudge, I'm going to create literally a shade in this part over here so it can look like stitches. Okay guys, I must confess that I don't like this line over here. I think that I didn't do it properly, so I think that I'm going to erase it and start over. So I'm going to do it again. For that, I'm going to use the Sample Beauty palette, and I'm going to use the shadow Smoky. Instead of going for a fluffy brush, I'm going to try with an eyebrow brush. Okay, I think that this time was better. I'm going to use a smaller fluffy brush for the shadow, and we are going to use from the Sample Beauty palette the shade Fudge. The nose is a tricky one. It's looking better now. What I think that I'm going to do is just to try to fade like gradient. So to create that effect, what I'm going to use is this shadow over here called Insta, and I'm going to go all the way around. What I'm going to do is to retouch, because when I erase everything, they are gone as well. I'm going to do that and I'll be right back. Now with a fluffy brush, in this case I'm going to use the Morphe M506. I'm going to apply this color over here that is called Florist, and now I'm going to use the shadow called Cottage just to give a little bit of depth. With the Morphe M456, I'm going to apply this yellow called Gemini. This is just to give you know, the transition moment. We're almost there, just the lipstick, the setting spray, and we're done. I drink some water. Clumsy. For this part of the lips, I'm going to use the Jeffree Star liquid lipstick in the shade Mannequin. And for the other half, I'm going to use the shade Wifey. Finally, the setting spray, and I'm going to use this Morphe X Jeffree Star setting spray, and this is delicious. Smells at strawberry and is amazing. So this is the final look. I hope that you like it. I found my inspiration on Instagram in one page that I follow that is called Undiscovered Muas. Honestly, it's not the first time that I see this. I remember that I saw a tutorial with Nikki. She created like the Phantom of the Opera, you know, like the whole face. She said that she found inspiration of one of the albums of Shawn Mendes, which I think that is really cool. So yeah, there are different interpretations of this look. I mean, in Shawn Mendes' case, I think that is not necessarily makeup driven, but definitely he has something like that. I hope that you liked the talk that we had today. If you have any questions, please let me know in the comments below. If you want to send me a private message, you can find me on Instagram at mario.winks. However, it's always important that no matter what, you go with your doctor. Please don't forget to subscribe, to like this video, and to share it with your friends. And I'll see you next time. Bye guys.